Oh, hi. I didn't see you there. I'm Dr. Kelly Richardson, and I'm from the Mayo Clinic. I specialize in mental diseases, and today I'm going to be talking to you about one of my cases that I have recently just gotten. The patient I have been assigned is Macbeth, King of Scotland. His townspeople and relatives are concerned with his current ruling and his actions. However, we are not able to directly contact him or be in the same vicinity as him. So to evaluate him and to diagnose him, we're going to have to look at our past patients and cases and compare them. In 2006, I was given the case of Andrea Jackson. She came in with symptoms of sudden changes from being joyful to being irritable, angry, and hostile. She showed signs of impulsion and restlessness. In addition, she showed signs of depression, which included loss of energy, insomnia, and sadness. We diagnosed her as manic depression, or commonly known as bipolar. There's nothing wrong with me.
I was feeling normal. I would be so happy, and then all of a sudden it would be like...
There's nothing wrong with me.
It's just so crazy. I was just so angry.
Like, what's wrong?
I'm living with it.
In the case of Macbeth, there's parallel symptoms and actions to those of Andrea Jackson. Like Andrea Jackson, Macbeth has shown symptoms of being joyful to irritable, angry, and hostile in just a flash. His servants and loved ones have informed us that he would be at dinner parties, joyous and reveling in the greatness of the event, and then switch to being irritable and having hallucinations. His servants have also informed us that he was impulsive and unable to make decisions.
I'm totally fine. I'm totally fine.
My next case is Paul Newman. He showed up to my ER on December 21st, 2011. He came to us with symptoms which include depression, anxiety, and stress. There are 4 types of post-traumatic stress disorder. One is reliving the event, which is re-experiencing syndrome, which includes nightmares, flashbacks, and reliving the event. The second is avoiding situations that remind you of the event, like avoiding crowds or loved ones. There's also negative changes in feelings, like staying away from relationships and not being able to talk about the certain event. There's also hyperarousal, which is feeling keyed up. It includes having a hard time to sleep and hard time concentrating. Paul Newman had these symptoms. He was living with PTSD.
As a child, I lived in the ghetto. There was a time when the dogs kept chasing me and chasing me. They just wouldn't stop chasing me. Now I can't stand being around dogs.
In regards to Macbeth, there are similar symptoms between Paul Newman and him. We have been in recent contact from diplomats that have been in recent contact with Macbeth. They say he was reliving dramatic events by hallucinations of someone close to him. Macbeth has PTSD.
I can't sleep much anymore. I have nightmares in the ghettos chasing me endlessly, and they just wouldn't leave me alone.
My next case was Mary Shelley. She came to us in 2005 with symptoms of social withdrawal, intense anxiety, delusions, hallucinations, and sense of being controlled by outside forces.
So what were you asking? Did you hear that? No? Oh, well. Hello? No. Hello? I'm not gonna hit the reporter. I'm not gonna kill him.
I am Frankenstein.
It is frighteningly apparent how Macbeth and Mary Shelley's cases are oh so similar. We have been in contact with Macbeth's servants, and they have told us that he has had many cases of social withdrawal. He would be locked up in his room and not speak to anyone. He was also walking around with intense anxiety and nervousness, and would also have delusions. Macbeth has schizophrenia. My team and I, mostly myself, have come to the conclusion that in regards to Macbeth, his symptoms have proven that he has been diagnosed with schizophrenia, bipolar, and PTSD. Macbeth is a complete nut job.